Hello and welcome. Today, we're delving into a complex and often misunderstood condition, interstitial cystitis, also known as bladder pain syndrome. This video will cover everything you need to know about this chronic bladder condition, from its potential causes and symptoms to diagnosis, treatment, and current research. The exact cause of interstitial cystitis remains elusive, making it a challenging condition to understand and manage. While a definitive single cause is not identified, researchers believe multiple factors may contribute. These include a defect in the bladder lining allowing irritating substances in urine to penetrate, an autoimmune reaction where the body mistakenly attacks the bladder, chronic infection, though this is debated, genetics, as there seems to be a higher incidence in some families, nerve problems, leading to heightened pain signals from the bladder, and allergies. It's often a combination of these factors that ultimately lead to the development of IC. The pathophysiology of interstitial cystitis is multifaceted. The primary issue appears to be an abnormal or damaged bladder lining, also known as the glycosaminoglycan or JAG layer. This layer protects the bladder wall from the irritating substances in urine. When this layer is compromised, these substances can seep into the bladder wall, causing inflammation and irritation. Mast cells, immune cells that release histamine and other inflammatory substances, become activated in the bladder wall, further contributing to inflammation. The nerves in the bladder wall become hypersensitive, amplifying pain signals sent to the brain, resulting in chronic pelvic pain and urinary urgency and frequency. Bladder capacity is often reduced due to inflammation and scarring, compounding the problem. Epidemiologically, interstitial cystitis is estimated to affect between 3 to 8 million women in the United States, and men are also affected, although less frequently. Diagnosis can be challenging, so the true prevalence may be even higher. It can affect people of all ages, but it's more commonly diagnosed in women in their 30s to 50s. There's also some evidence suggesting that individuals with other chronic pain conditions, like fibromyalgia or irritable bowel syndrome, are at a higher risk of developing IC. The signs and symptoms of interstitial cystitis vary significantly from person to person in their intensity. Some of the most common symptoms include chronic pelvic pain, which can range from mild discomfort to severe, debilitating pain. A persistent, urgent need to urinate, even when the bladder is not full, is a hallmark symptom. Frequent urination, often many times during the day and night, is also characteristic. Pain during sexual intercourse or dyspareunia is another common complaint, particularly in women. Some individuals may experience bladder spasms or tenderness. It's important to note that symptoms can fluctuate, with periods of remission and flares. Diagnosing interstitial cystitis can be challenging, as there's no single definitive test. The diagnostic process typically involves ruling out other conditions that could be causing similar symptoms, such as urinary tract infections or bladder cancer. A detailed medical history and physical exam are essential. A urine analysis is performed to check for infection. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, may be used to visualize the bladder lining and rule out other abnormalities. Bladder biopsy, a small tissue sample taken during cystoscopy, can help confirm the diagnosis. A potassium sensitivity test, or PST, where potassium chloride is instilled into the bladder to assess sensitivity, was previously used but is less common now. Symptom diaries, where patients track their urinary habits and pain levels, can be helpful in understanding the pattern of symptoms. While there aren't distinct types of interstitial cystitis in the traditional sense, the condition can manifest with different symptom patterns and severity levels. Some individuals may primarily experience pain, while others struggle more with urinary urgency and frequency. Hunner's ulcers, lesions found on the bladder wall during cystoscopy, are seen in a smaller subset of IC patients and often denote a more severe form of the disease. Non-ulcerative IC refers to cases where no Hunner's ulcers are present. It's important to understand that each individual's experience with IC is unique, and management strategies should be tailored accordingly. Unfortunately, there's currently no cure for interstitial cystitis, so treatment focuses on managing symptoms and improving quality of life. A multifaceted approach is often necessary. Dietary changes, such as avoiding bladder irritants like caffeine, alcohol, and acidic foods, can be helpful. Physical therapy, particularly pelvic floor therapy, can address muscle tension and pain. Medications including pain relievers, antihistamines, and bladder coatings like pentosan polysulfate sodium may be prescribed. Bladder installations, where medications are directly instilled into the bladder, can provide relief. Nerve stimulation techniques, such as TANSES transcutaneous electrical nerve stimulation, can help modulate pain signals. In severe cases, such as bladder augmentation may be considered, but it's generally reserved as a last resort. Because the exact cause of interstitial cystitis is unknown, there are no guaranteed prevention strategies. However, certain lifestyle modifications may help reduce the risk or manage symptoms. Maintaining a healthy weight, avoiding smoking, and staying hydrated can support overall bladder health. Managing stress and practicing relaxation techniques can help reduce symptom flares. Identifying and avoiding personal bladder irritants through dietary changes is also crucial. Regular exercise and pelvic floor muscle exercises, as recommended by a healthcare professional, can contribute to pelvic health. The prognosis for interstitial cystitis varies widely. Some individuals experience significant symptom relief with treatment, while others continue to struggle with chronic pain and urinary dysfunction. It's a condition that often requires ongoing management and support. Recent research is focusing on better understanding the underlying mechanisms of IC, identifying biomarkers for diagnosis, and developing more targeted therapies. Studies are exploring the role of the microbiome, the impact of inflammation, and the potential of new medications and nerve stimulation techniques. Support groups and online communities can provide valuable resources and emotional support for individuals living with IC, helping them navigate the challenges of this chronic condition and improve their overall well-being.